Chapter 3, Models of Case Management. The model of case management an agency uses often determines the ways in which case managers deliver services. Today there are 3 models of case management: role-based, organization-based, and responsibility-based case management. The case manager should be aware of each of these models, the way in which services are provided within each model, their similarities and differences, and their strengths and weaknesses. Role-based case management is the first model. It focuses on the roles the case manager is expected to perform. The second model is organization-based case management, and it focuses on providing a comprehensive set of services and meeting the needs of clients with multiple problems. Responsibility-based case management is the third model, in which case management function may be performed by family members or a supportive care network, such as neighbors or volunteers, and even by the client. This table appears on page 73 of the text, and it provides some examples of how these models of case management might work in practice. The goal of role-based case management is for the case manager to act as a single point of access for the client. The case manager may assume a variety of roles as needed. Some of the responsibilities of the role-based case manager include intake interviewing, data gathering, planning, linking to services, coordinating or delivering services, as well as referral and evaluation. The primary roles of the case manager in the role-based model may include broker, coordinator, planner, problem solver, and record keeper. The role-based case manager may be involved with a client depending on the client's needs. Limitations due to managed care and the need for short or long-term care will be factors in the length of involvement. The major strength of the role-based case management model is that the case manager is the single point of contact, and the case manager takes on the roles that are necessary to serve the client's needs. The major weaknesses of the role-based case management model are, first, that some agencies will limit the services they provide. This may mean more referrals to other agencies and a narrowed focus on assessment and service delivery. In addition, the role-based case manager may have a large caseload without much backup. The workload also may limit time for community involvement. The text discusses the generalist case manager, which is a function that is common in role-based case management. The generalist case manager has knowledge and skills applicable to clients from a variety of populations and with a variety of needs. In organization-based case management, the case manager may also act as a single point of access for the client, but this model differs from role-based case management in that all of the services are available in one location. Service delivery in this model may mirror what one might expect to be provided by a traditional extended family. The case manager in the organization-based model is responsible for providing comprehensive case management, which involves completing individual assessment and plan covering a variety of needs ranging from social support, housing, recreation, work, and community integration. The case manager may be responsible for coordinating services as well as leading a team of professionals that provide services to the client. The primary roles of the case manager in the organization-based model include advocate, broker, coordinator, planner, problem solver, and record keeper. Length of involvement in the organization-based model is dependent upon the individual client and his or her needs. The strengths of the organization-based case management model include the fact that services are provided in one location, whether it's inpatient, outpatient, or residential. In addition, client assessment considers the whole of the client and covers multiple dimensions of the client's needs. The major weakness of the organization-based model is availability of resources. If a client needs resources that aren't available within the organization, this can be a concern. In addition, the team that supports the client must be in agreement about the client's needs and the plan to support the client. Clients' family members may also become less engaged once the organization assumes responsibility for the client's needs. This model may be attractive because it's less likely that clients will get lost in the system, and they may be less likely to have to repeat information or duplicate forms. On the other hand, this model also may be somewhat like an institution, such as a nursing home or a group home provider. The cost of care in the organization-based model also can be expensive. In the third model, responsibility-based case management, the focus is on the transition of care from human service professionals to non-professionals. Teams of family, friends, and volunteers may work together to support the client. The goal of responsibility-based case management provides for both short-term and long-term involvement of the case manager, the coordination of services, as well as volunteer support and client empowerment. The case manager may be involved short-term during a crisis or for the long term for persons with disabilities, physical or mental illnesses, or aging-related concerns. In the responsibility-based model, the individual or team that is responsible for supporting the client provides service coordination and networks with others. The primary roles in this model include broker, coordinator, planner, problem solver, and record keeper. Strengths of the responsibility-based model are that it allows the case manager responsibility to be assumed by others in the client's life. It also is cost-effective and promotes the client's independence. Weaknesses of the responsibility-based model are that the individual or team designed to support the client may not have the client's best interests at heart. They may also lack the necessary knowledge or skills and be ineffective in monitoring service provision. This makes it very important for responsibility-based teams or individuals to have support from a professional case manager who can be involved as needed. This system can be effective when families and others involved on the client's team receive continuing education about the human service delivery system. The professional case manager must be a source of ongoing support when crises arise. Responsibility-based case management also applies to supportive care, which may be used for clients in rural areas, older adults, or persons with disabilities. This model reflects the strengths-based approach in that it focuses on building the client's strengths and resources rather than on what is perceived to be lacking. Self-determination is key in the responsibility-based model. A client who has learned to act as manager can provide long-term care for him or herself and for others. In each model of case management, a case manager might assume a number of roles. The work of case managers is often a function of the role they play in service delivery. For example, a case manager who's working as an advocate for his or her clients will often speak on behalf of clients, address issues of inequality and discrimination, work to influence government policy, or serve as a community organizer. The actual work of a case manager as an advocate would be very different from that of a case manager as a counselor. Other roles that case managers commonly assume include broker, coordinator, consultant, planner, problem solver, and record keeper. Many times a case manager may function primarily in one role but engage in other roles as needed. The broker links the client with needed services, helping the client choose the most appropriate service and negotiating terms of service delivery. The coordinator works with other professionals and agency staff to integrate and expedite services. In this role, the case manager can help with ineligibility, poor quality service, and unnecessary or irrelevant services. The consultant frequently is an outside professional who possesses expertise in a particular area. The consultant will identify problems, study them, and make recommendations. Cost analysis, quality control, and organizational structure may be areas where the consultant will assist. The counselor or therapist maintains a primary relationship with the client and his or her family. The counselor has a thorough understanding of the client's mental health and medical history and can monitor how the client's current situation supports or hinders progress. The planner takes the information obtained in the assessment phase of case management and evaluates it to determine the client's functioning and to assess service provision. In the problem-solving role, the case manager supports clients in becoming self-sufficient by helping them determine their strengths, find alternatives to their current situations, and learn how to solve their own problems. Problem-solving is a continual process, so the case manager must be prepared to address them throughout the day. The record keeper maintains detailed information about contracts and services that address client needs. Documentation links all the roles of the case manager together within each phase of the case management process. Within each model of case management, the case manager must be committed to cultural sensitivity when working with clients. The ethnic and cultural dimensions of who the client is, the client's experiences, and the client's goals will all interrelate and must be integrated in the process. Cultural competence encompasses three aspects of values, knowledge, and skills: awareness of one's own assumptions, values, and biases, understanding the worldview of culturally diverse clients, and providing culturally sensitive interventions during the helping process. In addition, attending to issues of identity, power, and advocacy provides focus for the case manager's cultural sensitivity and efforts. Professional certifications and standards also demand an ethical commitment to delivering culturally competent services. Case managers also are obligated to understand the multidimensions of each client's identity. This helps us to understand every client's uniqueness. We must understand the three levels that comprise an individual's identity. The universal level, which places all of us in the same genus and species of Homo sapiens that communicate through symbols. The group level, which incorporates beliefs, values, rules, and social practices that reflect culture, as well as gender, socioeconomics, age, geographic location, ethnicity, and much more that influence us and establish us as members of these groups. And finally, the individual level, which reflects the genetic similarity all humans share in combination with the non-shared experiences that make us unique. Being human allows us to enter into helping relationships, to form bonds, to communicate, and to solve problems. When we acknowledge how these variables influence how we think, how we behave, and what we value, especially those related to group-level identity, we can see how helping others becomes more complicated. The text discusses power in relation to culture on pages 96 and 97 of the text. When we think about power, we have to remember that it relates to how societies view groups and not how they view individuals. Power differentials, dominance, and oppression exist in all cultures, but how they are expressed, their characteristics, will influence social stratification in different ways. We must consider this when we think about what we have versus what our clients have not. We will talk about advocacy throughout the course because it's so central to the job of the case manager. We must ensure that everyone who needs assistance has the same opportunity to access it.